After knee surgery, including knee replacement, muscle atrophy sets in pretty quickly. And as I had mentioned in a previous video, the quads gets atrophied very quickly. In this video, I want to share with you what are the 3 simple and safe exercises that you can do right after your knee replacement that you can activate this time the other muscle group that's important to control your knee, which is your hamstrings. What are the easy and safe exercises for you to do to activate your hamstrings so that you can prevent atrophy from setting in right after your knee replacement? So make sure you watch to the end so you'll know all those 3 exercises. Hi, this is Reggie from Restore Plus Physical Therapy, and in today's video, I'm going to demonstrate to you 3 exercises that will activate your hamstrings and prevent that muscle atrophy from setting in, that are easy and safe enough for you to do right after surgery, right after your knee replacement, or shortly thereafter. Atrophy sets in very quickly because the muscle shuts down. When you have trauma to the body body tries to protect itself. Knee replacement or surgeries is one of those trauma. So what the body does, it shuts itself down, it shuts the muscle power down, and then when it gets weaker, it loses that muscle bulk. So the body atrophies, the muscle atrophies at a faster rate than it actually hypertrophies or than it gets bigger. You can think of it this way. When you go to the gym, you're trying to get bigger, you're gonna notice that it takes you months before you actually gain some increase in size. Muscle atrophy doesn't occur at the same rate. It occurs at a much faster rate. In a week's time, you already see the muscle losing the tone. A couple of weeks, you already see the muscle shrinking. So your hypertrophy for your muscle to get bigger and stronger occurs at a slower rate. Atrophy occurs very, very quickly. And you don't even have to do anything. And that's the thing. You don't even have to do anything. Atrophy sets in already. Meanwhile, as compared to when you're going to try to get bigger muscles, you have to have nutrition, you have to have the exercise, resistance, all those other things. There's a lot of components involved. Atrophy, you don't even have to do anything. It just sets in on its own. So that's why you want to prevent that as soon as you can when you have your knee replacement. So let's dive right into it. I'll show you these exercises that you can do to prevent that. Now, the first exercise that I want you to do to activate your hamstrings is called the hamstring set. So it's a muscle setting exercise, or it's a muscle activation exercise. So how do you do that? I want you to bend your knee a little bit, and then I want you to push your heel down onto the bed. So you're trying to do a movement of bending your knee, but the bed is actually preventing you from doing that. So you're pushing your heel down on the bed, you're trying to bend the knee, and then you're gonna feel that your hamstrings, which is the muscle at the back of the thigh here, that will get harder. So that means it's contracting. So that's how you do a hamstring set. Hold it for 5 seconds, you relax. Want you to do that multiple times. Do it 15 repetitions. You do it multiple times through the day. So that way you keep activating your hamstrings. Now, the second exercise that I want you to do to activate your hamstrings is the straight leg raise, but you're going to be on your stomach. So this is a little bit harder than the first one. So it's a little progression of the hamstring sets. So let me show you how to do it. You're going to be on your tummy. So let's say my right leg is the one that had the knee replacement. You're going to go on your tummy like this. Don't worry if you're wondering if it's safe enough to put weight or pressure on your knee. Yes, it is. It might be uncomfortable. Just maybe you can put some cushion or something, or just bear with the pain. It's not going to do anything to the prosthesis. It's going to be safe to put some weight on it, so that is fine. So go on your tummy, and what you want to do is keep your knee as straight as you can, and then you're going to lift the leg up and down. You're going to lift the leg up and down. When you do that, try to focus the muscle movement, the muscle contraction here, and try not to arch the back, because if you arch your back, then you're going to have some back problems. So you do that, hold it if you can for a second, and down. Do it 10 repetitions, move up to 15 repetitions, and you can do it multiple times throughout the day. Now, the third movement that I want you to do to activate your hamstrings is called the bridging. So it's a little bit more difficult than the hamstring sets. But if you're able to do this, then it will help your hamstrings a lot. And also, it activates your glutes as well. So you're hitting two birds in one stone. You're activating two muscles. So let me show you how to do this. So first is you're going to bend this knee. So you can bend both knees. Now, if you have limited flexion or limited bending on your knee, just bend as much as you can. Right? If this is as much as you can go, that is fine. So initially, first couple of days surgery, this may be difficult. In a week or two, 1 week, I think you should be okay. 2 weeks, definitely. I think 1 week, you should be able to start doing this already. So what you want is, you want to tighten your glutes, and you're going to push down on your heel and try to lift your butt off the bed. All right? And then down. And then again, up. That's why it's called bridging, because you're trying to form a bridge. You're trying to go as straight as you can, going up and down. You can hold it for a second and then come down, or if you're able to do it, hold it a few more seconds. Hold it for 5 seconds and then come down. And you do it multiple reps. You can then 10, 15 repetitions, and you do it multiple times throughout the day. Now, we just went through the first 3 exercises or movements that you can do to activate your hamstrings to prevent that muscle atrophy from setting in. And these are easy and safe enough for you to do immediately after surgery or shortly thereafter. Thank you very much for watching this video. Thank you very much for your time. Please share this with your loved ones so that when they had the knee replacement, they will know what to do, what are the safe exercises to do right from after the surgery to prevent that muscle atrophy from setting in. And they'll be comfortable, they will know that it will not harm their prostheses, and they will be off to a great start because it will prevent that atrophy from setting in, because atrophy, once it sets in, it's harder to recover from that. And do not forget to click on that subscribe button and turn on your notification so that you can get alerted once our new video comes out next week. And now, go watch my next video for a few more videos about knee replacement. Thank you very much, and I appreciate you.